We are exactly 4 weeks away from city pools opening for the season, at least in Boise. Meridian, Nampa, they look like they're holding off until June. And right around that time is when local television stations start doing news stories on water safety tips. What if we told you today it's the pool itself you might have to worry about this summer? There was a bill passed this last legislative session that was couched as just a regulatory cleanup bill, kind of get rid of some of the red tape, clean things up a little bit on our code books. Basically, there were duties assigned to the Department of Health and Welfare that the agency no longer dealt with. However, this bill did contain some unintended consequences, because of course it did. Like the fact local pools across the state of Idaho will no longer be required to be inspected by the local health district. Aspen Shumpert looked into what this might mean for pool safety.
I'm not sure they all realize the significance of how this will potentially impact public health into the future.
For decades, local health districts have been performing inspections on public pools per requirement of the state's Department of Health and Welfare.
And we'll look at everything from water quality, water clarity, the types of chemicals that are being used to make sure they're appropriate.
Those inspections also covered critical safety elements like proper signage and secured handrails.
I think the public expectation for swimming pools is to have some assurity of oversight to make sure that they're operating in a healthy and safe manner so that you don't get sick.
For Central District Health, which covers Ada, Boise, Elmore, and Valley counties, Director Russ Duke says they inspect 36 public pools each year.
Most of the time when things go well, it's great, and when it doesn't, it can be really bad for public health.
But those inspections are formally ending July 1st. House Bill 202, which is a 20-page health bill revising various regulations under the Department of Health and Welfare, has a few lines ending the state oversight for public swimming pools.
These rules are overly burdensome and too prescriptive. They even include provisions regulating the dimensions of diving boards. This bill takes DHW out as the middleman and allows for local control. The local health boards have statutory authority in 39414 to enforce health regulations and to do all things required for the preservation and protection of the public health and preventative health.
Changes local health districts are interpreting as removing required health inspections.
And the changes to the Department of Health and Welfare's authority, no longer having authority to essentially create rules for public swimming pool safety. The rules themselves that we use to do our inspections will also become obsolete at that point in time.
Director Duke says those inspections on public pools would only happen if the public pool operators ask CDH to do them.
Would they like our assistance either from an inspection standpoint or training standpoint, and that's what we're likely going to move forward with into the future.
Director Duke says eliminating preventative inspections could put public health at risk.
That's a reality, and those things can happen, even with the most well-run swimming pools, but things can and do go wrong. And that's often when we'll get called in. The majority of complaints that we get today aren't from the inspected pools, it's from the ones that are not inspected.
Director Duke says they are looking to the future on this and hoping this might even spark new partnerships with unregulated private pools and even newly splash pads that we're seeing turn up, and asking maybe that, they could turn to their local health districts to do some of those voluntary inspections now that nothing is going to be required.
Okay, so voluntary inspections, you're saying this summer these pools are then just opting in to have inspections?
Yeah, so there's a little history there. This isn't the first time deregulations have happened. Private pools used to be regulated, included in all of this, and then in 2000,
like hotel pools,
hotels, gyms, private neighborhood pools. Then it turned to just public pools in 2000. So it seems like we're kind of going back to private and public pools being on the same level there.
Should people be worried about the fact that these inspections are no longer required?
I think that's fair to say.
Yeah.
Also, local control. It's turning to local control. I asked Senator Van Orden, who's a sponsor of this bill, what that really means. She said that could look like city ordinances getting passed or health districts passing their own regulations. I took that back to the health district, and they said that is a possibility, but would have to be passed by legislature, and that seems unlikely to do. So they're not allowed to really enforce anything now that there's no rules set in place.
Right, it's okay, local control, but then nobody's doing it.
Right.
Okay, local control for safety, but not, okay, for flags. I got you. Thanks, Aspen.